Hi guys, this is Dr. Baum. So today we're going to set up a primary line as well as back priming and IV line. Okay, so this here is Mr. William Paget. He's in the hospital and he does have an IV. Okay, hi Mr. Paget, my name is Tanya. I'm going to be your nurse today. The physician ordered for you to have IV piggyback of clindamycin, and I see that you do not have any allergies. Okay, how are you doing today? Oh, you're good? Okay, wonderful. Can you tell me your full name? William Paget. Very good. How old are you? 74? Good. Where are you? In the hospital? Great. Okay, very good. So the first thing that I'm going to do right now is I'm going to perform hand hygiene, and I'm going to put on some gloves. Okay. I did see that he does have an IV on his right forearm, and that was inserted this morning at 10 a.m. by myself. It is a 20 gauge. How do I know that it is a 20 gauge? It is a pink catheter, so they're universal colors. Pink is 20 gauge, the green ones are 18 gauge, and then the baby blue ones are 22 gauge. Okay, so after a little while, you guys will all kind of recognize the colors and learn them. So I'm going to get a brand new alcohol swab. Okay, I'm looking at the surrounding tissue. If I see any kind of redness, any red streaks upwards, then of course I'm not going to flush that. I do have a flush, and I'm going to make sure to pull back first, get out all of the air, so there's no air in here. Okay, I'm going to scrub the hub. Scrub, 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 scrub. Nice and squeaky clean. And on the very first time, it needs to go in. Screw it on. Make sure that my connection is open here. And I'm going to try and pull back first. Don't worry if on IVs you don't get a flashback, because if they have been inserted for a longer time, you might not. And now I'm going to gently flush, and it should go in with ease. Mr. Paget, do you have any pain when I flush your IV? No? Okay, very good. So that flushes nice and easily. Okay, and you can flush 5 to 10 ml on this one here. Okay, so that flushes nice and easy. So my IV is all nice and ready. Okay, there we go. And then we dispose of our flush. Good. So since I now have this all done, I can go ahead and get ready with my TKO. A TKO means to keep open. That's usually 5 to 10 ml. Since I do have an Alaris, here's my Alaris pump, and nothing is running. This is my primary tubing, Smart Site Infusion Set tubing. Okay, so these you should find any and everywhere. I'm going to take the tubing out, make sure nothing hits the floor. That's standard on how it comes. Don't open up any of those paper tags yet. Okay, just the top one. It has a protective cover over the insertion site. So I have this right here. I'm going to get my normal saline 0.9% sodium chloride, and that would be a brand new bag. Okay, so as I go along, I'm going to pull out a tab, take the top cover off, put this in here, and as this is now open, this is sterile. Okay, don't fiddle around, don't touch anything. Hold it nice and close up here, and then just twist and turn it inside. Once it's inside, turn it around and hang it on your pole. Close this right here. Give it nice 2 squeezes. Half of your chamber should be full. Okay, so now I'm going to let some of the fluid come down. Do it nice and slowly. As long as the cap is closed down here, only drops will come out. Remember, this is only normal saline, okay? So it's not a big deal if something flows out. It would be very different if that would be medicated solution. I don't want any kind of bubbles in my line. So go ahead and close it as you feel like this is all nicely primed. We're looking at our line. There are not really any bubbles. Okay, so there might be some fluid on the outside, but that's about it. Okay, very good. So we're all good. Let's go ahead and switch our system on. System on. Push the button right here. And mind you, our system does not have a drug library. It's going to go through checks first. Say confirm, yes, the maintenance reminder. Okay, is it a new patient? We could put his name in, but we don't want to. No. So this channel here, because it says B, we're going to push the B channel. Right here. Okay, let's open it up right here. That's when the protective cover will come off. And it will give you those little beeps. It's just a reminder on how long it's going to wait for you. The top part goes in, and then it's just a plug and play. Plug it in right here. It's just reminding you the safety is still on. Yes, we know. And it's closed. Open it up on the bottom, and we can remove the paper on the bottom too. Okay, so we hit channel B. My rate for TKO, remember, it's either 10 or 5, so I'm going to put in 10. Volume to be infused, and I have about 100 in there, so 100. And we're going to start it. So let's just push start. If I'm not opening this here up, it's going to beep at you. Okay, remember, I haven't touched the tip. That's the important part. Okay, so let's have a little alcohol wipe, because I want to go ahead and connect it to the patient. Okay, we already flushed it. Squeak, squeak, squeak. And with one plug, we plug it in. There you go. Your TKO is successfully connected. So now the TKO is infusing. Okay. So as that is infusing, now I can go ahead and verify my clindamycin. Make sure you have the right client. Go over your medication administration rights. I want you to review all of your administration rights, as well as medication administration checks to do your safe medication administration. Okay, so I'm just focusing on how to do the back priming. You still have to go through all of your checks. Okay, so for your back priming, you need a piggy bag. This here is your clindamycin, the 600 milligrams, and it's in 50 mLs. My expiration date is 6/20/20. And I do need a secondary set, as well as a hanger to hang the primary line lower than the secondary set, so we can do the by gravity part. Okay, so I have all of this. So let's go ahead and prepare that. I'm going to take out my secondary set. Here you go. Secondary sets come in many different ways. This one here does not have a clamp. It only roller clamp. It only has a regular green clamp. So this makes it a little bit more difficult for you guys. Okay, so you have to be careful not to lose any medication. Right away, go ahead and clamp it. Squeeze it all the way in there, because otherwise you guys are going to lose your medication. Once you have that, go ahead and pull this out. There we are. Hold it nice and tight. Pull this off and wiggle it in. It helps to twist and push down. Okay, there we go. I want you to only squeeze the chamber once, to have only a small amount of medication in here. Okay, all right, so let's go over to our, and I'm gonna hang the other patient's medication stuff over here. Let's hang it up front here. Okay, so here is my primary. I'm going down the line and I see that it does have a connector right here. The important part to understand is that the secondary, my medication needs to go through the pump to be safely administered. Do not administer it through the closest, the most closest part from the patient, because otherwise it's not safely administered through the pump. It would just run right into the patient without going through the pump. That's a mistake that many students make. Okay, so closest to my bag goes through the pump. Okay, all right, so this is still clamped. I do have several little alcohol swabs. I can already hang this up here. All right, I'm gonna go ahead and pause my channel. We'll hit pause so nothing is running. With an alcohol swab, wipe this here. Wipe, wipe, wipe. Nice and squeaky clean. Take my secondary, open it, and with one plug, plug it in. Okay, so now they are connected. I can open this up. See on how it flows up? And as my line slowly primes, but it's not completely primed yet. So as I lower it, it will go up higher and higher. See? There you go. Now it's completely primed. There are no more bubbles in my line. So if I lower my piggy bag, the air gets pushed out of my line. That is back priming. Now I will put up my line up again and I hang my primary bag lower. There are no visible bubbles in here anymore, and the chamber is almost at the halfway now. Okay, so to program my pump now, I hit channel select on the B channel and many other ones came up. Let's hit my secondary channel. And even the picture shows there is a different picture, right? So my rate, I want to infuse my 50 mLs within half an hour. By calculation using dimensional analysis, that tells me that needs to be at a rate of 100 ml an hour because my volume to be infused is 50. And I hit start. Only if I verified this clamp is open, my bottom clamp is open, and I'm ready to go. Hit start. I see the green light, it is infusing, and on here it even reads secondary. Do not leave the room until you see drops coming down and it drawing from my secondary line. That's when you verify that successfully you have programmed the secondary. Once this is empty and there's no more fluid coming down from the secondary, the primary will kick in, so no air will be drawn into the line and into your patient. Volume to be infused is 49 and counting down, and then it will switch over. And that is how you back prime from your primary line. I hope that helps using the Alaris pump.